Okay, hi everyone. My name is Raquel Perez. I'm the Senior Communications Manager with the Miami Clinical and Translational Science Institute. And we're partnering with the Florida Department of Health and Florida Community Health Worker Coalition to bring you this webinar today. You're attending the education session for community health workers on novel coronavirus. And just a couple of housekeeping items before we get started. This webinar is being recorded and will be made available to you afterwards. There is a Q&A feature in this webinar, and we'll ask you that you please use that to submit any questions that we'll try to answer for you at the end of this webinar. So with that, I would like to turn it over to Ms. Brenda Lee Rodriguez, who will get us started.
Hello, good afternoon. Please, next slide. As we indicated, this is an education session for community health workers on the COVID-19 for today, April the 24th of 2020. We are going to have sent to you all the recorded audio, so just bear in mind to check the latest numbers from the links and to the materials of those credible resources we will be sharing with you that we are citing from as of today, April the 24th. Again, my name is Brenda Lee Rodriguez from University of Miami Clinical Translational Science Institute and University of Miami and the Florida Community Health Worker Coalition. And joining me today is Julia Monroe.
Good afternoon, everyone. My name is Julia Monroe, and I am a respiratory disease epidemiologist for the Florida Department of Health. Just a little bit more information about me. I have worked for the Bureau of Epidemiology at the Florida Department of Health doing respiratory disease surveillance work for about 5 years now. A lot of what I do is related to conducting influenza surveillance in Florida, but I also work on conducting surveillance for other respiratory viruses, your common cold viruses like rhinovirus or respiratory syncytial virus, and seasonal coronaviruses as well. I have been pretty heavily involved in the department's response to novel coronavirus. And as an epidemiologist working in surveillance, what my job has been is to develop ways to track where COVID is spreading, what populations it's affecting, if it's increasing or decreasing, and those types of things. So my portion of today's presentation is going to provide some more background on novel coronavirus, information on how it spreads, how to prevent infections, and provide you with some resources. But for now, I will turn it back over to Brenda Lee.
Thank you. Next slide, please. So for the past few weeks, the talk about coronavirus and COVID-19 has spread all over the news, social media networks, and even your daily chats with everyone in your life. I want to thank the Department of Health so we could put together this with a quick turnaround. And today we're going to focus on community health workers. And even though that is kind of built for Florida community health workers, it's just because we're going to provide very specific Florida state links, numbers, and information. We are going to share the same kind of information that is available on the science of COVID-19. So if you are listening to us from another state, you will be hearing this from your other credible resources. And also what is also specific about Florida session today is that you can receive 1 hour certification credit, and I'll talk to you a little bit more in a bit about that. We want to give special thanks to Venus Gines from the Dia de la Mujer Latina in Texas and the University of New Mexico Project ECHO for leading the field with their first webinars for CHWs and Promotores in early March, and having those sessions in English and in Spanish. So we are modeling some of this on their earlier work. Next slide. And the Florida CHW Coalition supports continuing education for professional development, and we encourage the uptake of the CHW certification and renewal. So currently, as you may know, the CHW certification in the state of Florida is voluntary, and it's managed through the Florida Certification Board. Thus, attending this webinar can be used for 1 hour of core competency credit. So to get your certificate, please send us back the post-webinar survey that you will be receiving after this call, along with the recorded audio link and the PDF file of the presentation. The survey coming back to us is important because that's how you are going to receive that certificate of attendance for your CHW credit for the state of Florida. And give us a week. We have a large number of registrants and hopefully of attendees today. So within a week, we will be replying back. Next slide. And these are the learning objectives for today, because we're going to go over some of the CHW competencies that make us join other public health professionals in responding to the current situation. We actually have been declared, community health workers and promotores have been declared an essential critical infrastructure worker during the COVID-19 response. And this was from a memorandum issued on March 19 by the Department of Homeland Security. So we are there in the trenches and recognized by the federal government. We're going to also go over some of the probable causes, spread, and symptoms as the science part of this. And we will end with some of those myths and rumors that you may encounter either in person or online, and how to educate the community and cite responses from those credible resources we'll be sharing with you today. Next slide. These are the areas of action for the promotores or community health workers, and that we share at the national level with other promotores and community health workers. We do have those core competencies of communication and education skills, interpersonal relationships, service coordination, and foundations of health. And we're going to go over in detail on each of them. Next slide. For communication and education, the most important thing is to stay informed with credible sources of information. And what do we mean by credible sources? Is those entities that have the knowledge and the authority to investigate and learn and share that information with us. We have to, as community health workers, listen to the concerns of our community, our relatives, individual members, and listen with empathy. Empathy meaning care, interest, and without personal judgment. We usually have to use respectful language and keep in mind the level of literacy of the individuals we're working with. And literacy meaning choosing the words that people will understand. Being honest also about when we don't know the answer. It's okay to say, I don't know, I'll look it up for you, and follow through. And we're fortunate that the Florida Department of Health have put together materials and education resources with a very good level of literacy that is reachable by many in our community members, and they are available in English, Spanish, and Haitian Creole. Next slide. Well, the next area of action of interpersonal relationships, we know that promotores and community health workers work as part of a team. So we're gonna continue pounding the message of that we are in this together. It's okay to ask for help. And this is a time that you can cultivate contacts of your patients, clients, and other representatives in organizations via phone calls, text, and emails. And when we say cultivate contacts, that means stay in communication. This is a time when you show your care and that you are a resource in those vulnerable populations in the community, because you as a community health worker can demonstrate that cultural and linguistic competency within interactions. Next slide. For the next core competency and area of action, we identify the service coordination and community resources. And that's what usually highlights the important role of a community health worker, because you know where you can call for local resources. And this is the time to find out what services are available, what new partnerships have come together in your community or nearby to support those individuals and families in need. You're going to keep up with your local ordinances and closures instructions, and keep on building relationships with community contacts. This is the time that you kind of take inventory of all your contacts, the phone numbers, the updated hours for service in your clinics, federally qualified health centers, when the local food banks will be open and have distribution lines. Also, those tobacco cessation programs that will assist with all the stress management that many will face. And local county hotlines like the Florida Domestic Violence Hotline for mental health support services and Florida Poison Control numbers. We'll be sharing some of those later today. Next slide. In terms of foundations of health, that's the scientific part of the knowledge base that CHWs share with some very specific disease and conditions. And in this case, we're going to learn more about respiratory diseases like the flu and the conditions like allergies, and how those are different from the current COVID-19. We're going to learn more about staying healthy. And very important, the link between physical and mental health, because what you're gonna be assisting your community partners and clients is about what things can they do to support themselves? What can they do to connect with others? And in case of need, if they want to go and quit smoking or get assistance on how to quit smoking to cope with stress, there is the Florida tobacco-free hotline, and that number is 1-877-822-6669. And you can remember that also with this acronym, with this other way to remember it. 1-877, you can now. And also help is there for you in Spanish. The coping with stress and anxiety also raises issues of possible domestic violence situations, and you can also provide this number for those that would need it or might need it, and that is 1-800-500-1119. I'll repeat that number of the Florida Domestic Violence Hotline, 1-800-500-1119. Next slide. And now for the section on science, I will be passing it through Julia, please.
Thank you, Brenda Lee. So next we're going to switch gears and I will give some background information on coronaviruses. So coronaviruses are a large family of viruses that cause illness in animals and in humans, and they're named for the crown-shaped spikes that stick out from their surface. So in Latin, corona means crown or wreath, and the virus looks like the shape of a solar corona, so that's how it got its name. Coronaviruses circulate both in people and in animals. And there are two main families of coronavirus that cause illness in people. So there are alpha coronaviruses and beta coronaviruses. In the alpha coronavirus family, there are 4 common seasonal coronaviruses. You may have heard of those. Those are 229E, NL63, OC43, and HKU1. Most people get infected with one or more of those seasonal coronaviruses in their lifetime, and they usually just cause mild illness, like runny nose, sore throat, headaches, fever, your common cold type symptoms. But occasionally they do cause more severe illness, particularly in older adults or people who have underlying health conditions. So they do have the potential to be more serious sometimes. Beta coronaviruses, those are a little bit more severe, and there are 3 viruses in that family that are known to have caused illness in people. So there's severe acute respiratory syndrome, or SARS, that caused an outbreak in 2003, but it never widely circulated in the United States. And then there's Middle East Respiratory Syndrome, or MERS, which was identified in 2012. And MERS still circulates today, but it's not widespread. Most MERS cases are in Saudi Arabia, and cases are also occasionally detected in other countries in the Arabian Peninsula. And then we have COVID-19, which is our 3rd beta coronavirus. And that brings us to our next slide. All right, so that brings us to novel coronavirus 2019, or COVID-19. And COVID-19 is a disease that's caused by a new beta coronavirus that's called SARS-CoV-2, or SARS coronavirus 2, which was discovered at the end of 2019 in Wuhan, China. COVID-19 spreads from person to person, and the World Health Organization, or WHO, declared the outbreak of COVID-19 a public health emergency of international concern on the 30th of January this year, and then declared it a pandemic on the 11th of March this year. Next slide. All right, so next we're going to talk a little bit about how COVID-19 spreads. But before we get into talking about transmission, I just want to preface this by saying that COVID-19 is a brand new disease, and we're still learning exactly how it spreads and the severity of the illness it causes. So what I'm providing you with today is the best information that we have today, but we are still learning new things about COVID-19. So based on our current information, which also includes our knowledge of how other coronaviruses spread, we believe that COVID-19 is primarily spread from person to person via respiratory droplets. So when a person who is sick with COVID-19 and is in close contact with a well person, and the sick person talks or coughs or sneezes, that results in respiratory droplets in the air, and the nearby well person may breathe those respiratory droplets in and become infected themselves. But the well person has to be close enough to the sick person that those respiratory droplets can reach them. And the droplets usually go out as far as 6 feet. So that's why you may have heard that you should stay 6 feet away from other people. And we're going to talk about that more later in the presentation. Some studies have suggested that COVID-19 may be spread by people who have the virus but don't have any symptoms, and that's something that we're still learning about, but that's also why you may have noticed there have been more recent recommendations that people who aren't sick wear masks in public, and we'll talk about that as well. Less frequently, COVID-19 also spreads from contaminated surfaces or objects. So for example, when someone who's sick with COVID-19 coughs or sneezes, some of those droplets may land on nearby surfaces like a table, and then a well person may touch that table and then touch their eyes or nose or mouth. And it's possible that some people may get sick this way, but we don't think this is the main way that COVID-19 spreads. Even though we don't think it's the main way it spreads, we do still think it's a good idea that you wash your hands frequently, disinfect surfaces, and avoid touching your face just to be safe. But the primary way that COVID-19 spreads is from person to person. Next slide. All right, so people with COVID have reported a wide variety of symptoms, but fever, cough, and difficulty breathing are the ones that are the most common. So that's what we tell people to look out for, especially if you've had exposure to someone who knows they had COVID-19. The symptoms could be mild or severe, but they usually present between 2 and 14 days after you've been exposed to the virus. Next slide. So next, we're going to apply what we learned about how COVID-19 spreads, and we're going to talk about the steps we can take to prevent us from getting sick with COVID-19. So just unfortunately, there's not a vaccine right now to prevent COVID-19, and there's no specific antiviral treatment you can take if you do become infected. So the best way to prevent the illness right now is to avoid being exposed to the virus and also avoid the possibility of exposing other people. Next, we'll talk about the steps that you can take to avoid exposure and possibly avoid exposing other people as well. Next slide. So step number 1 is to practice social distancing. And practicing social distancing means that you should try to keep 6 feet between you and other people when you're not at home. Avoid hugs and handshakes, large gatherings, and just being in close quarters in general with people who don't live with you. Practicing social distancing also means that you should stay home as much as possible. And the reason why goes back to when we talked about how COVID-19 spreads from person to person. So if you're within 6 feet of an infected person, there's a possibility that you could breathe in that person's respiratory droplets, especially if that person is coughing or sneezing or even talking. So keeping a distance between yourself and other people reduces the chances of that happening. Next slide. So the next step is to clean your hands often. And the most effective way to clean your hands is with soap and water for 20 seconds. So I personally like to sing happy birthday to myself 2 times while I wash my hands to make sure I've done it for long enough. If soap and water are not available, use a hand sanitizer with at least 60% alcohol. And make sure you wash your hands after you've been in a public place. That's important, and the reason why goes back to when we talked about how sometimes COVID-19 may spread from contaminated surfaces. So if you touch a contaminated surface and then you touch your eyes or your nose or your mouth, you could become infected. So that's why it's really important to clean your hands frequently. Next slide. So again, avoid touching your eyes, nose, and mouth. And this is because you could have the virus on your hands, and then if you touch your face, you could become infected. So if you need to touch your face, of course, just clean your hands first like we talked about, especially if you've just been in public. Next slide. So it's also really important to cover your coughs and sneezes. So to prevent COVID-19, you should practice what we call good respiratory hygiene. And when we say good respiratory hygiene, what I mean is that you should cover your mouth and your nose with a tissue when you cough or sneeze, and then throw that tissue in the trash and wash your hands right away. And this is so you avoid releasing respiratory droplets in the air that someone else could breathe in, and also so you avoid getting your respiratory droplets on surfaces and contaminating those surfaces as well. If you don't have a tissue, you can cough or sneeze in the inside of your elbow, kind of like the picture is showing here. Next slide. So our next step is to clean and disinfect high-touch surfaces. So another way to prevent infection from contaminated surfaces is to clean and disinfect what we call high-touch surfaces daily. And those high-touch surfaces are things in your home or your work environment that you touch a lot. So doorknobs, countertops, your cell phone, those types of things. If the surface is dirty, you can clean it first with a detergent or soap and water, and then use an EPA disinfectant, a diluted household bleach solution, or an alcohol solution with at least 70% alcohol. And there are links included with this presentation if you would like more information about that. Next slide. So next we'll talk about our newest guidance, which is that people should wear a cloth mask or face covering when you're around other people in public. So these masks may prevent the spread of COVID-19 by people who are infected, but don't realize they're infected because they don't feel sick. So of course, we always say if you're sick, you should stay home, but there are some people who might be infected with COVID who don't feel sick at all. So that's why we have this recommendation to wear cloth masks or face coverings when you're in public. So these masks should be worn by everyone except for children who are under 2 years old. People who have trouble breathing should also not wear the masks. Or if anyone who's not able to remove their own mask also shouldn't wear a mask because we don't want to cause any trouble breathing. And again, the purpose of these masks is so that the people who are wearing the mask don't infect other people. And I also want to emphasize that you shouldn't wear a mask that's designed for healthcare workers because we need to make sure that they have an adequate supply of the masks that they need. So cloth masks are what we're recommending. Also, even if you do wear a mask, you should still continue to keep 6 feet between you and other people. Wearing a mask isn't a substitute for social distancing. You should still stay home as much as you can and just use that mask when you do have to go in public for necessities. So if you have to go to the grocery store or go to the doctor or something like that, that's when you should wear the mask. The mask isn't perfect. So you should still practice social distancing. It's just an added layer of protection. Next slide. So on this slide, I have a list of the groups that are at higher risk for complications from COVID-19. So those are people who are 65 years old or older, people who are residents of skilled nursing facilities or long-term care facilities, and people who have underlying conditions, particularly if those underlying conditions are not well controlled. So chronic lung disease, including moderate to severe asthma, serious heart conditions, immunocompromising conditions, or things that cause someone to be immunocompromised, like if they're undergoing cancer treatment, if they smoke, if they've undergone a bone marrow or organ transplant, if they have immune deficiencies, poorly controlled HIV or AIDS, also prolonged use of corticosteroids and other immune weakening medications. Also people who have severe obesity, diabetes, chronic kidney disease, liver disease, etc. Those are the people who are at higher risk for severe illness. Next slide. So next we'll talk a little bit about what you should do if you're sick. Most of the people who get COVID-19 have mild illness and are able to recover at home without any medical care. While you're at home, you should take all the prevention steps to prevent people in your household from getting sick. So you should separate yourself from other people and pets in your home as much as possible by staying in a separate sick room and using a separate bathroom if you do have that option. You should not share personal items like dishes with your other household members. And then you should make sure that you wash items thoroughly after you use them. So your dishes, your drinking glasses, those type of things, make sure you wash them really well. And again, clean and disinfect those high touch surfaces daily. So those things you touch all the time, like your cell phone, your table, countertops, those types of things. If you need to see your doctor, you should call first so that they can be prepared so that you don't expose anybody in the doctor's office to COVID. And then just make sure that you pay attention to how you're feeling and monitor your symptoms in case things do get worse. Next slide. So if you develop trouble breathing, persistent pain or chest pressure, new confusion or inability to arouse, if you have bluish lips or face, or any other severe concerning symptoms, it's really important that you get medical attention immediately. You should call 911 and tell them you have COVID-19 or that you might have COVID-19, again, so they can be prepared with proper protection equipment so that they aren't exposed. You should also, if you do have COVID-19 or think you have COVID-19, it's a good idea to call your healthcare provider, even if you don't go in for care, because your healthcare provider can tell you what symptoms that you should look out for and what might be severe or concerning. Next slide. So if you're told you have COVID-19, or if you test positive for COVID-19, it's really important that you follow CDC guidance, you stay home, you stay in touch with your healthcare provider, and that you follow your healthcare provider's advice. Also, you should notify your close contacts and tell them to self-isolate for 14 days, and that they should also monitor their health in case they start presenting with COVID symptoms as well. And that's so you don't spread the virus to other people, and the people who you may have exposed also don't spread the virus to other people. Next slide. So next, we're just going to talk about some of the things that the Florida Department of Health is doing to address COVID-19. So Florida Department of Health personnel and County Health Department epidemiologists and nurses, as well as our laboratorians and our systems developers, pretty much everyone who works for the Department of Health is supporting this response in one way or another, is working really hard to keep Floridians safe. So we are collaborating with our local partners to conduct enhanced surveillance for COVID-19 so that we can figure out where the activity is and who's being affected by it. The local county health department epidemiologists are identifying and monitoring cases, contacts of cases, and are arranging for laboratory testing and just generally talking to those people and making sure that we prevent any further spread of the disease. Also, we are creating lots of reports and other documents and resources and communicating really regularly with our healthcare providers and the public so that all of the most recent up-to-date information is out there for everyone. Next slide. So we also have our website, which is available in multiple languages. It is a very inclusive COVID-19 website, and it is packed with resources. It includes all the information we've covered today, as well as the most up-to-date information on COVID-19 activity. And the website can be translated into Spanish or Haitian Creole just using those icons at the top right of the screen. Next slide. We also have our community action survey, which is on our website that you and your friends and family can complete. And the purpose of that survey is so the Florida Department of Health can gather some additional information from the public in a systematic way so that that information can inform the distribution of resources throughout the state. So if you'd like to take that survey, we really do appreciate that information. It's really quick. Next slide. All right, so next I'm going to give a quick update about the current COVID-19 activity situation. So as of this morning, over 2.7 million cases have been identified in 185 countries across the globe. This map is from the Johns Hopkins University's Coronavirus Resource Center, and that is on their website, and I highly recommend checking that out if you're interested in learning more about the global spread. It's interactive and it's really neat. Next slide. All right, so national guidance on the 16th of March, President Trump and the White House Coronavirus Task Force issued their 15 days to slow the spread guidance. And then on the 29th, they extended that guidance, renaming it to 30 days to slow the spread. Next slide. So on the 1st of March, Florida reported its first 2 cases. Those were in Hillsborough and Manatee counties. And our governor issued an executive order establishing Florida's protocol for COVID-19, and the state surgeon general issued a declaration of public health emergency for the state of Florida. And then on the 9th, the governor issued Executive Order 2052, declaring a state of emergency. More information on those executive orders can be found via that link. Next slide. So on April 1st, which became effective the 3rd and will extend through the 30th, unless it's extended further than that, there was an order that says that seniors and those at risk for complications shall stay at home and limit the risk of exposure. And it also says that all persons in Florida shall limit movements and personal interactions outside the home. And this executive order is essentially mandating social distancing practices that we talked about earlier. More information on that executive order is available via that link if you'd like more. Next slide. Right, so cases in Florida, there have been almost 29,000 lab-confirmed Florida residents with COVID-19. There were 185 lab-confirmed non-Florida residents as of this morning. So those are people who are residents of other states but tested positive in Florida. There have been 987 deaths and 8 lab-confirmed Florida residents that were tested in other states. This information is updated twice daily, usually around 11 in the morning and 6 in the evening if you want to check it out. Next slide. So this shows our daily confirmed cases in Florida residents for the last couple of weeks. Since around the 18th of April, the number of lab-confirmed Florida residents has remained relatively stable, around 750 per day, with the exception of the 21st, where we did see a bit of an increase. There were 881 that day. Next slide. So this graph just shows the number of people who have been tested. So those are positive and negative tests together. So you can get an idea of how many tests we're doing each day. And that has also been pretty stable for the last few days, around 12,000 tests per day. Next slide. Again, I just wanted to remind folks that all the information presented is available on our website. That's the best place to go for the most up-to-date recommendations and activity updates. And like I said, there are buttons on the website that can translate the website into Spanish and Haitian Creole. We also have lots of educational outreach material on the website as well, and everything is available in Spanish and Creole. Next slide. I believe this is going to go back to Brenda Lee.
Thank you, Julia, for all the scientific information. And we have received a lot of questions that we hope to address them at the end. And in lieu of that, we will be summarizing those answers and sending back, along with a PDF of the presentation today and a link to the audio recording. Next slide, please. So for community health workers, in dispelling some of the myths and rumors and misinformation that is being spread out. We do need to treat people with respect and empathy, as I indicated before. And the best thing science is telling us is don't repeat the rumor, but actually just correct and reinforce that correct information. And going a little bit beyond that is discussing some of the source of the concern and how is it relevant for that individual or family. Because then you're able as a community health worker to offer resources and take them to the next level of activity. Next slide. In terms of some of those myths that we have, and of course we could be here hours just discussing all the stuff that is available either through your WhatsApp, social media, but we're gonna just take a look at some. And we have heard now more about exposing to sunlight and hand dryers as being effective to kill the new virus. No. The information that we want you to reinforce is that you need to wash your hands with soap and water. And in lieu of that, in case the soap and water, the good reliable source, soap and water is not available, then as a backup, you can use the alcohol-based hand sanitizing rub and dry them with paper towels or the dryer. Just to dry is not to kill the virus. Next slide. In terms of ultraviolet disinfection lamps, and here we get to discuss about sterilization and disinfection. Please don't use the UV lamps and should not be used to sterilize hands or any other body parts, please. Exposure to UV radiation can cause skin irritation and more. So please do not do that. Next slide. And here with other myths to dispel about spraying directly alcohol in any level of purity or chloride all over the body to kill the virus. Please do not, especially in contact with eyes, mouth, or nose, will be causing more problems. And it can be harmful. And here is a very important number that you should share with your patients and the community, the Florida Poison Control Centers, because exposure to and inhalation of cleaners and disinfectants has been reported in great spikes at both national level and the Florida call centers as compared to previous years. So please reinforce the message to clean safely. Don't mix the chemicals, wear protective gloves, use in well-ventilated areas, and store the chemicals out of reach of kids and pets. And in you are suspicious of that a kid or a pet has inhaled or ingested cleaners or disinfectants, please call the Florida Poison Centers. Next slide. This is to reinforce the message to clean safely and do not inject or put in your nose or other delicate areas of your body. There is no evidence of rinsing your nose with saline water will prevent the virus. Next slide. Also, we have seen a plethora of miracle cures or eating this or eating that to prevent. Of course, healthy eating habits is important. And some individual foods and substances and nutrients have some antimicrobial properties, but it's a minimal quantities. So there is no evidence that eating certain nutrients or food products can prevent or treat COVID-19. Please reinforce the message of not succumbing to scams of available products online, and reinforce the availability of the poison control line that is answered by medical professionals and in different languages. Again, that number 1-800-222-1222. Next slide. We have heard a lot about the vaccines, and maybe those already available for pneumonia could help protect for COVID-19. No. Again, the message, no current vaccines are available for COVID-19 in the world. You can protect yourself and others against those scams and fraudulent products online and social communication platforms. Please, those available vaccines for other respiratory diseases are available, but they will not protect you against COVID-19. Next slide. Other ideas we have heard is that, oh, are antibiotics effective in prevention and treatment? And again, a big fat no. Antibiotics are not effective in preventing or treating viral infections. An antibiotic works for bacterial infections, that hence the name. So with hospitalized patients that have COVID-19, they do succumb to other type of infections, and they may include bacterial infections. Therefore, they may include treatment with antibiotics, but that is not for the original infection of COVID-19. Next slide. Are specific medicines for preventing or treating the new coronavirus. And let me repeat that again. There is no specific medicine recommended to prevent and treat. The people who have COVID-19 may be treated with other medicines to address the symptoms or to take care of other severe illnesses or other diseases or conditions. Next slide. And these are just been a snippet of the many rumors or misinformation that you may encounter online and through the social media platforms. So please reinforce the correct information, provide the numbers for assistance depending on the situation of the individual patient or client that you're working with. Refer them always to credible resources. And all this will be shared with you again as a PDF. After the webinar, you will be receiving a link with a post-test that will be sent to you. And that needs to be sent back to me. And probably within a week, I will be able to send you the completion certificate. Now I will be bringing it back to Julia with some reinforcement of credible resources that are available to you. Next slide.
Thank you, Brenda Lee. So if you or your family or anyone you know has questions about COVID-19, we have an entire call center that's dedicated to answering those questions. And when you call this number, there are Spanish and Creole speakers available to assist you as well. Next slide. So for trusted resources, these are the websites that we recommend that you use for accurate and up-to-date information on COVID-19, how it spreads, and the actions you should take to protect yourself and other people. So those websites are going to be the Florida Department of Health website, the CDC or Centers for Disease Control and Prevention website, the World Health Organization website, and also the Florida Certification Board. Next slide. All right, so our final couple of slides just include all of the resources and websites where you can find the information and sources for what was shared with you today. Next slide. All right, thank you.
We have some minutes. We wanted to make sure that we provided all the information that we had for you before answering any of your questions. Again, if we don't get to your question today right away, There is the availability of the 24-hour, 7 days a week number that you can call right away. And again, that number is 1-866-779-6121. And we also are going to try to summarize the answers to the questions that have been posted in the Q&A section and send those back to you when the email goes out with the post survey and the PDF of this slide. So you will be receiving those, and you're welcome to forward those to others.
Okay, this is Patricia from the CTSI. I can go over some of the questions. Julia and Brenda Lee, thank you for your presentation. Would you like me to go over some of the questions?
Yes, please.
Yeah, so I've divided the questions in different sections. So first, in terms of transmission, how long are the droplets staying in the air?
So we're still learning about how long the droplets stay in the air. So I would just recommend checking out the CDC website for the most up-to-date information there. I don't know how long off the top of my head. My apologies.
Quick question.
What we have seen is like 6 feet. That's why the space.
Right. So when you cough or sneeze or talk, those droplets can go out as far as 6 feet. And then from there, they can land on surfaces. But in terms of how long they hang around in the air, I would recommend checking out the CDC's website for that information. But in general, the most important thing is that you remember that when you are in public spaces, that you should try to keep 6 feet between you and other people if possible, and that will be the best way to protect yourself from being exposed to those droplets.
All right, second question is about how do we sanitize cloth masks?
The best way to sanitize the cloth mask would be to wash them. Again, CDC may have more specific information on that, so I would recommend checking out their website.
Okay. Another question is when you are walking outside and you are wearing a mask, do you still have to practice physical distancing?
Yes, absolutely. The mask is not a substitute for practicing social distancing. The mask is just an added layer of protection. It's important that everyone wear a mask because, like I said, some people may have COVID but not be experiencing any symptoms. So if everyone's wearing a mask, the idea is that we limit spread from people who feel perfectly fine but might have the virus.
Thank you, Julia. The last question about transmission is can the virus be transmitted via bodily fluids, meaning not through the nose or mouth, but sexual transmission?
So right now, we don't believe that it can be transmitted right that way. We think the primary way that the virus can be transmitted is from those respiratory droplets. So if someone else breathes in the respiratory droplets, or if the respiratory droplets land on a surface and someone touches the surface and then touches their eyes, nose, or mouth, they could also be infected. But again, the primary way we believe the virus is spreading is from person to person via those respiratory droplets. And that's why we want you to try to maintain a social distance and stay 6 feet from other people who are not in your household.
That also responds to the question about the spread, if they can be spread by mosquitoes. So thank you for that response, Julia.
Of course.
Yeah. The second section, the type of questions relate about safety. For instance, does the state provide PPE to first-line workers? The state, or how do first-line workers get their PPE?
How do healthcare workers get
equipment?
I'm sorry, is the question how healthcare workers get PPE?
Yeah, first line workers, do they get can they get the personal protective equipment from the state? Where do they get the protective equipment?
So sometimes the local county health departments will coordinate with different facility types to ensure they have adequate PPE. But that is provided a variety of different ways, and it's not always the Department of Health that provides that equipment.
Okay. Another question is, are there sites where you can be tested if you are asymptomatic?
Yes, if you are symptomatic and you think you need to be tested, you can contact your healthcare provider, and your healthcare provider will order a test for you if it's appropriate.
How about if you are not symptomatic, if you are asymptomatic?
If you're asymptomatic, but say you think you've been in contact with someone who might have COVID, then you should contact your healthcare provider to see if a test is appropriate. In general, if you haven't had any contact with a known COVID case and you don't have any symptoms, you probably don't need to be tested. But if you're concerned, you should contact your healthcare provider.
Okay, another question about safety and monitoring. Does the DOH monitor self-quarantine people? People who are required to be self-quarantined, is there a monitoring process?
I'm sorry, is the question if they should monitor their health?
No, is the Department of Health monitoring the people who are required to be self-quarantined?
So the Department of Health, most of this is coordinated at the county health department level. So the county health department is getting in contact with people who are close contacts of confirmed cases and asking them to self-monitor for symptoms for 14 days. And if they develop symptoms, they should call their local county health department and let them know so that testing can be arranged.
Okay. Another question on safety and testing. Are there protocols established to test in challenged communities?
I'm sorry, could you repeat the question?
Yes. Are there protocols to test in challenged communities?
So there are lots of different protocols for testing. There are tests that are ordered specifically by healthcare providers or people who are coordinating care for different communities. So that is how the testing protocol is generally set up. We also have surveillance testing protocols where we are trying to get a sense of where the virus is circulating, but not for diagnostic purposes. So there are a variety of testing protocols, but it depends on who is providing care to that community.
Okay. A question about how the state will prevent the spread of COVID-19 with limited testing.
Right. So even without testing, there are things that we can do to limit the spread of COVID-19. So even if you're not sick, you can do your part to limit the spread as well by following the guidelines that we presented in today's presentation, practicing social distancing, washing your hands frequently, trying to avoid going in public unless it's absolutely necessary, and then wearing a cloth mask when you do go in public. Those are all things that you can do to help prevent the spread of COVID-19. Of course, testing is important, but at the same time, a test doesn't really change the fact that if you are sick, whether you test positive or not, of course, you should stay home until you feel better so that you don't get other people sick. So even without testing, there's a lot that we can do to prevent the spread of this virus.
And a final question related to testing. I know that we're about to close, but just one about recent information on animals and cats. Do you have, Julia, something to say from the Department of Health?
Sure. So I can talk a little bit about that just really briefly. Just the other day, it was announced that there were 2 pet cats that tested positive for COVID. Both of those cats had really mild illness. And routine testing in animals is not recommended at this time. If there are any more cases in pets, of course, the USDA will share that information with the public. Right now, we are still learning about SARS coronavirus 2 in pets. But right now, we don't have any evidence that pets are playing a major role in spreading the virus in the United States. So until we know more, the recommendations we have for pets are that you basically kind of follow the same recommendations that you would for people. So don't let your pets interact with people or animals outside your household. Try to keep your cats indoors if that's possible to limit their interactions. Walk your dog on a leash and maintain at least 6 feet from other people and animals. If you can avoid dog parks where there are a large number of people or dogs, that's always a good idea as well. If you are sick with COVID-19 and you have a pet, you should try to restrict your contact with your pet just like you would with the other people in your household. So if it's possible, have another household member care for your pet. Avoid contact with your pet like petting or kissing or snuggling or sharing a bed. If you must be the one to care for your animal while you're sick, wear a cloth face mask, wash your hands before and after you interact with them. And CDC's website has more information if you'd like to check that out as well.
Thank you, Julia. Thank you for the CTSI staff on the support of this platform brought to you this community education session on COVID-19, especially targeting our community health workers, frontline, critical infrastructure workers in the state of Florida and nationwide. Again, my name is Brenda Lee Rodriguez from the University of Miami and the Florida Community Health Worker Coalition. We thank you for your attending today. You will be receiving a follow-up email with a PDF of this presentation and an audio recording of link of this session today, and also a link to a survey. Please send that survey completed back to us via email so you receive a 1-hour certificate of attendance that it might be used for your Florida CHW certification or credential renewal. Thank you so much. Until the next one.
Thank you.
Thank you.